So typically, if you're using the vaginal estrogen cream and it's been prescribed for you for vaginal atrophy or what we call genitourinary syndrome of menopause or vaginal dryness, the cream will come in a tube. It's a long tube with a screw cap, and there's actually going to be an applicator. The applicator kind of looks and is reminiscent of a tampon applicator. You insert the applicator into the vaginal opening and then push the plunger, and it will deliver the cream into the vaginal canal.
The best way for this medication to work is to maintain as much contact with the vaginal mucosa as possible so that that vaginal estradiol can absorb into those tissues. So the best time to do this is right before bed, so that when you're laying horizontal, the medication has more time to maintain contact with the vaginal walls to get more of that estradiol absorbed through your system. If you're going to plan to have intercourse, wait till after you're done having sex to insert the vaginal estradiol. The next morning, you're going to want to make sure that you wear a panty liner or wear underwear that you're not afraid to have to change, because the cream will have all the estradiol absorbed through your skin, but anything additional, like the vehicle cream that is holding the estradiol, is going to come out when you're vertical again and walking around. But you really should clean this out because you don't want any vaginal secretions on this, because we do have healthy bacteria in the vagina but if they are kept on plastic, they will grow and it can get kind of funky. You can also get a Q-tip and clean in that area too.